if you're going to choose any kind of regenerative or stem cell therapy for yourself, I think it's fair to say that you should really understand what is it and what is the science behind this and how does it work. So I'll share a little bit about that with you in this video. I'm Joya Vanderlaan. I'm a functional medicine family nurse practitioner. I do a lot of regenerative medicine as well, not only the stem cell injections and PRP, but also peptides and hormones and optimizing other areas of people's health in measurable ways. Stem cell therapy is a super exciting, fairly new, but really not all that new world. And what's so exciting about it is that we're seeing healing and avoidance of surgery, avoidance of drugs, elimination of pain, restoration of function. Yeah, without surgery, without medications, the body just has this capacity to heal itself when we give it the right things and take away the things it doesn't need. Let's clarify what we mean by stem cells. That's kind of the simple way to describe what a lot of these treatments are using to heal. But the misconception that most people have, if they haven't spent time learning about this, is that we inject actual stem cells and those cells differentiate and turn into your own tissue. So that's actually not what happens. When we inject Wharton's jelly from an umbilical cord, or when we inject exosomes or amniotic fluid, what actually happens is there are so many powerful signaling factors in there, including things like exosomes, but then also structural factors that help to cushion the joint and repair the joint. The stem cells are actually coming from our own body. So the things that we inject, Wharton's jelly, amniotic fluid, exosomes, those are actually very powerful signaling molecules. These signaling molecules signal our body's own healing mechanisms, which are vast, to send healing powers, we'll call them, healing factors, cytokines, the good kind of cytokines, to the area that needs healing to regenerate the tissue. It signals stem cells. It tells our body, hey, create more stem cells. We really need more stem cells here, to heal this torn labrum, to heal this meniscus, to heal this cartilage defect or this worn down cartilage. So what we inject is not actually stem cells that turn into your own tissue, although the end result is that your own stem cells come to repair that tissue. What I use in practice, what I think is the best option, is a product from Wharton's jelly of babies that have been delivered via C-section. They're alive, they're well, they're going home with their parents. And what would otherwise be garbage, the placenta and the umbilical cord, are now used, I love this, are now able to be used for healing for people, for other people, which is wonderful. And even the amniotic fluid would otherwise be garbage. And now we can collect that from healthy, born babies going home with their parents. We can collect that amniotic fluid and use it as this powerful healing tool so that people can help avoid surgeries and medications and just general life dysfunction. What I am not using is stem cells derived from adipose or fat tissue and stem cells derived from your own bone marrow. Those are traumatic extractions. That's a whole procedure in and of itself to harvest those things. The processing of those things is prone to error, especially when done in an office setting. And so my feeling from the research that I've done and the training that I have received is that the amniotic fluid and the Wharton's jelly products are really the most reliable, effective, and safe to use for most people. The other misconception that people have is that this stuff comes from aborted fetuses. Even just saying that gives me the chills. I would never. These are products all coming from babies who are healthy and born and going home with their parents. So I have no ethical issues at all with these products. So in a couple of my past videos, I've talked about how these actually work. So I'm not going to go into too much detail, but I do want to mention again how they work. It's tissue regeneration from basically the recruitment of your body's healing factors, stem cells and cytokines, inflammatory factors, immune regulation, to come and create an environment for healing and also create the structures and call the stem cells for healing. So regeneration of tissue, modulation of inflammation, and modulation of the immune system are sort of at the three-arm approach to why stem cell therapy helps to regenerate and heal. How can we use stem cell therapy? So the most commonly known and really beneficial area is orthopedic uses. And it's interesting because the more I learn, and I'm a nerd about this, so I'm constantly seeking out information about this, we actually started using this in racehorses. And people love their racehorses, and they will do a lot of things to make their racehorses perform well. There's a lot of money in that, right? So we know that it works. And what they would do originally is take the birth product from horses and use that, just like we use birth product from humans now, to inject and use these as regenerative products. We know they work. This is not brand new, but we're just using it on humans now in the last number of years. The orthopedic cases are by far the most common that I do. Joints and ligaments and tendons, inflammation, degeneration, damage, injury to those things. Very, very effective for healing those and regenerating damaged tissues. And again, the ability to avoid surgery and medication and heal tissue and eliminate pain is huge. And that's what these products do. There's also high potential for treatment in autoimmune cases because one of the reasons this works, one of the mechanisms of action is immune regulation. An IV of something like a purified amniotic fluid can have really powerful effects on any autoimmune conditions like lupus or rheumatoid arthritis. And there are many, many more research studies going on now to look at that and how we can help people with these autoimmune conditions. And then the third that I don't treat in my practice, but I wanted to let you know about them anyways, is neurological conditions. Spinal cord injuries are really, we're really hopeful about the treatment of these conditions with stem cells. So just really a lot of hope for people suffering with these conditions as well. We talked a little bit about ethical considerations in the use of these products. And in the past, not the recent past, the more distant past, these stem cell products had potentially come from aborted babies. And to me, I would not use products like that. For one, I am a Christian person and I believe that life is sacred. And that life starts at conception. And so using a product that eliminated a life would not be something I would be okay with. So again, these products come from the umbilical cords and or the amniotic fluids of healthy C-section born babies. And this was not the reason that the C-section had to happen. The C-section needed to happen for whatever medical reason. But they're able then to collect the tissues and the fluid that would otherwise be garbage, and now we can use it for these amazing healing purposes. You know, of course, we want to ask questions about safety of any therapy that we choose to use, in addition to the efficacy. So these are very safe. It's interesting if you learn about immune privilege, is when a woman is pregnant, the tissues inside the uterus are not all her own. They're half from the dad. And so the woman's body and these tissues have to be created in such a way that the woman's body does not recognize them as foreign and attack them. And so they're what's called immune privileged. So things like amniotic fluid and the placenta and the Wharton's jelly, the umbilical cord, are all immune privileged tissues, which means we do not have to match you with a same blood type donor. So very safe. There's no rejection concern that has happened. And really, as of my last research and last seminars, there really have been very few, if any, safety concerns, and certainly nothing like death from these. So they're really very, very safe. In fact, a lot safer than some of the other treatments that are offered, like surgeries and opioids. So if this sounds interesting to you and you are in pain or you have a bum joint and you're looking for healing, and especially if you're in our area in Illinois or can travel to our area, we would love the chance to consult with you and treat you and just get you better, regenerate, what you need regenerated. The first step to that would be booking a discovery call, and you can book that either on our website or in the link below. I would love to help you. I get so excited every time that I see another patient's success. So I would love for you to also be one of those success stories.